Cyclin E is an important cell cycle regulator. It regulates the transition from the G1 to S phase of the cell cycle. And there's been work done, championed largely by Hanan Kiyomarsi, who's a scientist at MD Anderson, who first discovered that Cyclin E can actually be cleaved into what's referred to as low molecular weight isoforms. And what Dr. Kiyomarsi has shown is that these low molecular weight isoforms are tumor specific, meaning we don't see it in normal breast tissue. Importantly, these low molecular weight isoforms of Cyclin E, you can kind of consider it as Cyclin E on steroids in that it causes the cells to proliferate through the cell cycle more rapidly and be less susceptible to inhibition by the naturally occurring inhibitors of the Cyclin E, cyclin-dependent kinase interaction. So from a breast cancer standpoint, Dr. Kiyomarsi published in the New England Journal that low molecular weight Cyclin E was associated with a poor prognosis in breast cancer, hence suggesting that it could potentially be a therapeutic target. And Dr. Kiyomarsi and her group are continuing to pursue this line of investigation and in fact are very interested in using cyclin-dependent kinase inhibitors in the clinic for patients who have tumors that overexpress Cyclin E. I had actually worked in Dr. Kiyomarsi's laboratory when I was a postdoctoral fellow, but given my interest in immunology, what I did was to take a little bit different direction and determine whether Cyclin E could actually be a target for immunotherapy. Could we make a vaccine against Cyclin E? And the interesting observation we made was that there is an immunogenic peptide, meaning an E75 equivalent in Cyclin E. It's amino acids 144 to 152, and this is work that I did in collaboration with Jeff Moldrum, also at MD Anderson. Jeff's a stem cell transplant physician, and so he was actually investigating this phenomena in leukemia, and I came along and was looking at it in breast. And so we kind of combined efforts, and what we found was that this immunogenic peptide is actually in the low molecular weight forms, suggesting that Cyclin E could be a target for immune therapy because one, it's overexpressed in breast cancer, and two, it's abnormally expressed in breast cancer. And so where this is right now is we've published this preclinical observation, and we need to make a decision as to whether this is a therapeutic strategy we want to pursue, but it certainly is a possibility to develop a Cyclin E targeting vaccine that would work very much like the HER2 targeting vaccine. And it would be in a population of patients that have overexpression of low molecular weight Cyclin E, which happens to be about 70% of triple-negative breast cancer, which of course is one of those buzzwords that's of interest to all breast cancer clinicians if we could have something that targets triple-negative breast cancer.